Okay, welcome everyone. In case you are wondering where you are, you're in the panel with talking about the city and state homelessness and housing initiatives. We have a little bit of a different setup because we have Ishai here in the end of the day and there's 9 panelists. So we're trying a little bit of a different arrangement. We are going to hear about the city and the state housing plans, particularly as it relates to supportive housing. We're going to hear updates on the homelessness plans, what the federal landscape is presenting us with, how our State Office of Mental Health is playing a lead role in Ishai, as well as its many other priorities, increasing mental health services and downsizing institutions, and the role that supportive housing can play. And I would just like to personally thank each and every panelist for being here today. Really, their ongoing partnership is so crucial to the work that we do every day. And I have to say they are all available. They've all been terrific and very supportive of the network and our work and your work. So please join me just in thanking them. So I'm going to introduce the panel, and then we're going to start with some brief opening remarks, and then do some Q&A. So my direct right, this panel probably needs no introduction, but Commissioner Steve Banks, New York City Department of Social Services, Barbara Guinn, Executive Deputy Commissioner, New York State Office of Temporary and Disability Assistance, Dr. Anne Marie Sullivan, Commissioner, State Office of Mental Health. To my left, RuthAnne Visnauskas, Commissioner and Chief Executive Officer, New York State Homes and Community Renewal. And Maria Torres-Springer, Commissioner, New York City Department of Housing, Preservation, and Development. Before each commissioner just gives their brief remarks, I want to do a quick lightning round. We did this last year and it was pretty successful, about anything that's burning on your mind right now. One question you would like to ask. We're not going to answer them. We just want to hear about any issues. Not going to answer them right now, I should say. We are going to try to answer them during the panel. Any burning issues or questions that you want us to address? Oh, come on. Nothing. Ralph Fasano, nothing on your mind?
We'd like to hear how the city and state are going to work together more harmoniously, more effectively moving forward. There's been a lot of good work between the city and state. We'd love to hear how we're going to join together and do great work together. Great.
So continuing city-state collaboration. Anyone else? Anything else? Wow. Okay. Whoa, there we go.
I have one, and I guess it's an odd add to add to that, the network's collaboration with other people.
Terrific. Thank you. Okay, all right. So without further ado, I'm going to kick it off with Commissioner Banks for a few brief remarks.
Thank you very much. It's alphabetical, right?
Yeah.
Okay, I'll take that. Good morning, everybody. I just wanted to give a little context, and then I'm sure we'll have an opportunity to talk more going forward. I think it's important for us to understand the background, which is the increase in New York City in homelessness of 115% increase in homelessness between 1994 and 2014. The census in the Department of Homeless Services shelter system was about 24,000 in January 1994, about 31,000 in January 2002, and about 51,000 in January 2014, and it's about 60,000 currently. And that 115% increase really comes against a background of the loss of 150,000 rent-regulated apartments. That's about 16% of the stock. Rents went up more than 18%, and incomes went up less than 5% during this period of time. That's really the sort of background issues. And on top of that, the shelter system in New York City really developed in a very haphazard way. Developed in reaction to a series of court orders, which I guess I'll plead guilty to, and without an underlying real organizing principle. And so the things we're going to talk about this morning are how we're addressing those background issues relating to affordability and relating to how homelessness can be prevented and how shelter can be provided in a more effective, people-focused way. But it is important, I think, to as we proceed, to understand that the shelter system census was flat for the first time in a decade, year over year between 2016 and 2017, and that's as a result of the substantial amounts of investments that we have made that we'll be talking about over the course of the morning. So those two bookends I want to leave you with as we proceed. Tremendous increase in homelessness because of housing affordability, and tremendous investments to break that trajectory, and the census now flat for the first time in 10 years.
Great, thank you. And can everyone hear in the back? No. Okay, we're gonna work on that. I'm just gonna encourage all of my speakers to speak into the mic. Can you hear me? Yes. Okay, so it really takes a dive in, Barbara.
Okay. All right, I'll do my best. Good morning. On behalf of the Office of Temporary and Disability Assistance, very pleased to be with all of you here today. OTDA oversees a range of homeless services through our oversight and partnership with local social services districts and nonprofit contractors throughout the state. We are very happy to be here and to continue to work with all of you to create and to support supportive housing throughout the state. Supportive housing fills a critical role, both in terms of our overall need to make sure we're keeping people housed and not homeless, but also, obviously, it makes a profound difference to each and every individual who's able to access a unit of supportive housing. So thank you. Just very quickly, a couple of the priorities for our agency in this lane. Certainly, we will continue to focus on our oversight of shelter services to make sure, that this critical range of emergency housing that we have available when necessary in New York State, which is obviously necessary more often than we would like. We want to make sure that we continue to have good oversight of the shelter system. We fund, certify, and inspect over 850 shelters throughout the state every year. And we will continue to do that, again, working with our partners. We are seeing definitely there are investments being made both in terms of the physical plants and the conditions of the shelters, but also significant improvements in the investments made for services so that when people are residents of the shelter system, that they're receiving the services that they need, both to move to permanent housing as quickly as possible, but also to provide supports, hopefully to reduce the amount of trauma that homelessness can cause to families, and also to provide support so that people are able to secure and retain permanent housing, including employment supports. In this area also, we're working to increase linkages so that those in shelter certainly have access to health care and necessary treatment. And this priority is reflected in some of the work that we're doing with our sister agencies, OASIS and Office of Mental Health, to bring treatment to individuals in shelter and to do a better job of facilitating their engagement in those necessary services. So again, we are seeing investments made. We are very appreciative of the attention to this issue that New York City has made under the direction and leadership of Commissioner Banks. So we are seeing improvements. Another priority is outreach. I think all of you know that this is something that Governor Cuomo considers to be an absolute obligation of government to make sure that individuals in New York who are homeless are not residing on the street. We have work to do in this area, but again, in some ways this is a place where New York can be very proud. Although we don't want anyone living on the streets, as compared to other states, we are definitely a leader in this area. And that certainly is, reflective of the fact that our governments at the state and local level, as well as our communities, are willing to make these investments to keep people off the streets and appropriately housed. With homeless prevention, we'll continue to fund a large number of rent subsidies as well as eviction prevention measures, including rent arrears. From a procurement note, I would just let you know and remind you that our Solutions to End Homelessness program, we will be having a new RFP issued for these services, hopefully by the end of this year. And those services are available to provide support services to individuals who are at risk of homelessness, rapid rehousing, eviction prevention, as well as other services. With respect to supportive housing, our New York State Supportive Housing Program provides, again, support services to individuals who are residing in supportive housing so they can retain that housing. We did receive a small increase in our general fund for homeless services this year of about $1.4 million, and we do intend to dedicate that to improve services through NYSHIP. And hopefully we'll be giving you more information on that plan soon. Also, a procurement coming up this summer, we'll have a new procurement for housing opportunities for persons with AIDS, and again, that provides long-term rental subsidies. With respect to the overall state's housing plan and trying to increase the availability of affordable housing, which we know is absolutely necessary in order to reduce that homeless shelter census, our HHAP program, RFP, that did open this past at the end of May, that $63 million RFP is available, and we will begin accepting applications on June 28th. And so, we have a lot of work to do. We're proud to be in a state where there's definitely no shortage, as we can see by the number of people at this conference, of individuals who are passionate about providing housing to individuals. And so we are prepared to continue with this work with you. Thank you.
Thank you. Dr. Sullivan.
Good morning. First, I would just like to thank so many of you in the audience who work with us every day at the Office of Mental Health to provide really great housing for our clients. There is really, I've been at a number of openings of new housing. I've visited a lot of your, where you work and where our clients live, and it's just remarkable. So thank you for working with us. Thank you for being partners and for working sometimes with some of our most challenging recipients. So thank you so much. I'm going to go through this really quick. Don't panic about us slide thing. It's going to be really quick. But I just wanted to point out that in the 1950s, because this is talked about a lot, there were 90,000 individuals in state mental institutions, 90,000. Today, we have, as you can see up there, we have about 3,000 beds. 1,000 of those beds kind of fall into, 3,000 plus fall into forensic. It's a big decrease. But what do we also have is over almost 45,000 units of housing. So we're still not there yet. We're not there yet in terms of making the balance work, but we are still living with the legacy of, I believe, the deinstitutionalization of over 40 years ago. But we're moving, and basically you guys are the champions of making it happen for our patients, because this year, 3 years, we've moved 2,500 individuals a year and longer out of my state hospitals into your housing. 5% came back. That's remarkable. And many of those individuals were 5 years and 10 years in my state hospitals. I can't thank you enough. Okay, so where are we still going? I'm not going to go through these numbers, but it really talks to just the fact that the pipeline is still there. We're still working on increasing the housing for the seriously mentally ill through Ishai and for some other dollars in New York, which is still there. And just to point out that reinvestment, as we have closed 600 beds, 650 beds in the state system, we've opened up 1,300 housing opportunities. So basically, as we have lowered those beds, it's been a 2-for-1, where we've been able to put more housing up. Another big issue, which I just want to highlight, is forensics, and this is something that we're going to be working on over the next year. We have about 600 beds earmarked for individuals who have left prisons from the state system, but that's not nearly enough. And we need to work very closely with all of you to develop that link of housing, because these individuals, when we provide, the average number of returnees to prison is 50% within 2.5 years. 50% return to prison. And it's the same numbers for individuals with serious mental illness. If you give housing and wraparound services, you cut that in half. So we know this can work. It can decrease the concentration of our seriously mentally ill in the prisons. We just need to get more of it up and running, and we're going to be working on that. And we also have the adult home pipeline, which we're still working on. We have moved now, I think it's almost 700 individuals out of adult homes into housing in the community, again, with the help of all of you, and that's pretty remarkable. That means that individuals who for many years had been in somewhat institutionalized adult homes are now living on their own in the community. And then just to finally say that you can't do this without supports in housing, and we're aware of this, and we're working with all of you to strengthen those supports. A new addition right now is Health Home Plus. Health Home Plus is going to provide smaller, regulated caseloads for individuals of high need. So the caseloads will be like 12 to 15. And so if individuals with SMI are living in your housing and they have Health Home Plus, which is a care manager, you can now work with them in a much more intense way than had been in the past. And that has started, I believe, as of May, the guidance went out. This will be fully up and operational as of July. We're also trying to connect a lot of other services. We're improving crisis services around the state so that when you have an issue with a client, you know who to call and how to get help, maybe after hours. We were just with a housing provider who said that while they were thrilled about our MIT teams, our mobile integration teams, the big issue for housing providers is the after hours coverage. Because after hours, what happens is you go to the ED, and that's not a good thing. So we're working on trying to support all of you on that. We're not quite there yet. We have a couple of pilots we're going to be starting, and then we're going to be working with our CPEPs and also with our mobile crisis intervention to help do the coverage. So a big piece, and I know you guys all know this, but we have to be there for you as well, is not just to have the housing, which is remarkable and beautiful, but also to have the supports, especially for our clients, so that they can really integrate into the community and truly become not just living in the community, but true contributing members of the community. And that's where all this work is going on. So we'll continue to work with you on this, and I'll just stop there. Thanks.
Thank you. Maria, I'm going to start on the outside edge.
Great.
Do you want to
Of course.
let us know what's happening
Thank
at
you, Laura.
HPD?
Good morning, everyone. It's really a pleasure to be here with colleagues across city and state government. Thank you to Laura. Thank you to the network, not just for hosting today's event and organizing. They do such a terrific job each year, but really for what has been tireless advocacy and leadership on such a critically important issue. So, of course, no surprise to anyone in this room, we here in New York City continue to face a housing emergency. It has been one that has existed in our city since 1974. We have extremely low vacancy rates. There are way too many families that are homeless or on the brink of homelessness. And that crisis, the housing crisis and affordability crisis, interestingly, has been one that I think has, its face has changed over the course of the last few decades. Of course, everyone remembers the, in many ways, physical and financial devastation of the 70s and 80s in so many neighborhoods. That devastation today is different. It's a devastation that is born in many ways out of the successes that this city has seen, very hard-fought successes. There are many, many signs of growth in our city, but the other side of that coin continues to be a dire housing and homelessness crisis. And so what that means for us on this panel and for everyone, of course, in this room is the need to continue to look at this issue both comprehensively, but to also do everything that we can to look at the issue through different lenses. And so for us at HPD, just to highlight how we've been tackling the issue, I'd mention three things. First is that in recognizing the real urgency on the ground, we started with what I think was a very ambitious affordable housing plan last fall. That plan was accelerated and expanded to now be 300,000 homes by 2026. We inherited, due to the terrific work of our predecessors, a very strong public-private engine, and it's one that we have tried to feed with programs and capital and policies and partners so that we're able to now and hopefully sustain into the future a production of about 25,000 units per year. Of course, it's not just about the units, it's about who we are actually serving through the production programs. And so over the course of the first 4 years of the administration, 88,000 homes have been financed. A full third of those homes are for extremely low and very low income families. More than 7,000 of those units are for formerly homeless households. Second, we're working certainly hand in glove with sister agencies to not just produce new homes, but to ensure we're doing everything that we can to keep people in their homes and to really fight displacement. Key to this, of course, has been our work to preserve homes across the 5 boroughs, but also we're bringing new tools to this fight. including over the course of the last couple of years. Our work through our Landlord Ambassadors program, community-based organizations working very closely with landlords and managers who will hopefully take advantage of our financing programs. It includes a new program that we are rolling out called Neighborhood Pillars, where we're really working with not-for-profit, mission-based organizations to acquire buildings that might have rent-stabilized units but aren't currently regulated, to bring them into a city regulatory agreement, and new approaches like a speculation watch list or the certification of no harassment pilot citywide. And of course, all of our enforcement efforts. These are tools that we're hoping will work in tandem in order to really bring the right tools to the fight in terms of tenant harassment and displacement. And third, and certainly important to everyone in this room and the topic of today's conference, our work in supportive housing. We have been, over the course of the last few years, making sure that we are meeting the goals of previous programs while also ramping up our work as part of the NYC 1515 partnership, 15,000 units over 15 years, a close collaboration with folks on this panel, of course, all the colleagues that we have at DSS. And for those who may have heard last night, so the split, of course, 7,500 scatter site, 7,500 congregate. The congregate units primarily led by HPD, although it's a collaboration all around. We've financed Housing New York to date 3,000 supportive housing units through the budget negotiations with the City Council. And I think, as you all know, Speaker Corey Johnson, a huge advocate and champion of supportive housing. Funding has been accelerated in HPD's budget in order to increase the congregate production from 500 units a year to 700 units a year, and that will start next fiscal year. And that's the type of investment, the type of increase that is only made possible not just because of the advocacy and leadership of the people in this room, but because you are, of course, all of our partners in actually getting those units off the ground. And so I'll end by saying that there are many, many different tools and approaches that we're bringing to the issue of homelessness and affordability here in New York, and it's just necessary. There is no silver bullet to this crisis. What it requires is really using every lever that's within our reach. It requires the incredible expertise of the people in this room and all of our partners across industry, and the political will in order to get done the types of things that can be challenging but are so necessary for really to support the most vulnerable people in our city. And that has been the approach that we've taken. I think that it is the right one, an approach that reflects both the urgency and the complexity of the problem on the ground, but also reflects our collective vision for the type of city that we want to be. Thank you.
Thank you. All right, RuthAnne.
Thanks. Good morning, everybody. I feel really bad for everyone standing in the back. You can sit maybe on the floor up front if anybody wants to, but I think I was one of those people not so long ago, so I feel for you back there. Thank you, Laura, for having me. Thanks, everyone on the panel. It is really a privilege to get to work with everybody up here. We, to pre-answer Ralph's question, we all do talk a lot and work together a lot and find ourselves at events a lot, and it's been a great collaboration. I will just make sort of 3 quick points because I'm sure we want to jump into more meaty questions. But so as we think about homelessness and supportive housing, we sort of have 3 sort of buckets that are sort of part of our overall housing plan, some of which have been touched on. But so obviously the supportive commitment is really important, the 20,000 units over the next 15 years, to doing the first 6,000 in this first 5-year period. We are sort of well underway. We'll talk a little more about where we are and about some of the things we need from people in this room to keep that commitment going. The second piece, and as Commissioner Banks talked about, is rent stabilization. So obviously keeping people out of the shelter system and providing making sure that the rent stabilization system itself is working is important. It is a challenging system, and we'll also talk a little more later about some of the things that we are trying to do to bring units back, to keep units in the system, and also looking forward some changes that obviously have already been spoken about, but to be able to use sort of the rent stabilization system as what it is in terms of stabilizing the housing stock in New York City. And then the third big bucket, which my state colleagues and I will talk a little bit about, is also the Interagency Council on Homelessness, which was set up by the governor. I am lucky enough with Fran Barrett to be one of the co-chairs. And that really works when we sort of have this sector doing the supportive housing, sort of the private market on the rent stab side. The Interagency Council on Homelessness is really sort of a very nuts and bolts looking at sort of types across the sort of spectrum, what are both sort of low-hanging fruit and big policy changes that need and can be made to make the system work better. So I think sometimes we do only talk about units, but really we think of all three of those things as our approach to homelessness as we think about supportive housing, and we'll sort of delve into some of those in more detail when Laura asks me very hard questions later.
Yeah. Okay, thank you to everyone. So we're going to bounce a little bit back and forth between housing issues and homelessness issues, and of course they're very intertwined, as you heard from our commissioners in their opening remarks. But I think just to start, because it is a supportive housing conference, we'd love to hear from both Maria and RuthAnne about the status of NYC 1515 and eShy and how things are going and what you might want to convey to the audience on how to make it even better.
I'll start. It's going great, but we can always be doing more. So we are still, as many of you know, because you're doing them, finishing old OMH capital contracts. We are still doing New York 3, and we are sort of very deep in on the beginnings of the eShy commitment. We will talk a little more about this later. Obviously, we are in our third round of eShy, which people all are aware since they're all applying, and the third one was just released. While we are doing great, we can do more. We had a little bit of a we were surprised that we didn't have as many applications on the 9% side this year for supportive, so please bring us supportive housing applications into our 9%. We have a set aside, we have an early round in November. I feel like I'm a sales pitch. We can absorb more there, and we would very much like to do that. On the 4% side, we're super busy. We have 6 deals that are closing in June. We have another 10 that will close between now and the end of the year. You will hear us and see us saying a couple things. One is, please come in for technical assistance. We love to provide it on the 9% side, and we also will do it on the 4% side. Darren Scott, Lenny Skrill, we have people out and about who are regional directors who will work with you on applications to make sure you are competitive. Number 2 is we are pushing the percentages of supportive housing within our projects up, and you will hear that from us consistently. I think the state generally has sort of a different, I don't know what the word is, but we had consistently, I think, been doing sort of lower percentages of supportive. As we rolled out SHOP and as we've rolled out this big commitment, you will hear us saying to people, we want to see not 30%, but 40 and 50% of the units as supportive housing in deals. So don't be surprised if you hear that. We are anxious to get our production numbers up, and that is obviously one way we do it when we all have fixed pots of resources. And the third thing is that while I'm sort of also begging you for more business, I will also say we are very busy on the 4% side. And I think another shift for people is that where traditionally people might have come in and closed their deals in like a 3-month time frame, we and the city and everybody are constrained by volume cap, and our pipeline is very full, and we are now staging people. As I said, we are sort of full through the end of the year for deals. We will take more, but we are pushing people into next year and sort of framing out our pipeline over the next 12 months. So do be patient, do come in early, do keep talking to us so we can sort of refine and make your projects sort of as competitive and the best projects that they can be. So that's it for me.
Also great on our end. So it's been the past 4 years, as I mentioned earlier, has been one where we are both trying to make good and close out and do well in previous programs, and also ramp up 1515. And so we are on track in terms of the awards that are supposed to be made, and I think Commissioner Banks will speak more about this later in terms of 1515. On the congregate side, as I mentioned, 3,000 units have been financed, and that is a mix of NY3, some federal sources, and the first 500 units or so of 1515. And so that is, we are well on our way. But as I mentioned earlier, we also want to do more. And so increasing from 500 to 700 requires a number of things. First, requires continued partnership with everyone in this room, requires us to really prioritize the scarce resources that we have in order to make sure that all of these deals happen. It requires identifying as many sites as we can within the city inventory and continuing to work with all of you in terms of private sites. And it also requires, because all of these, and hopefully someone will come up with a Venn diagram on how it all works, but we know and acknowledge that there is work to do, in particular with the streamlining for those projects as we all move forward that have both city and state funding. RuthAnne and I talk all the time. The teams certainly collaborate all the time. More of that is needed in order to make sure that there is sufficient clarity about how exactly the different city and state programs interplay. But we both want to maximize production. We want to do that in a way that is accretive to the world in terms of supportive housing units, and also do it in a way where it's just clear to all of the partners who we work with what exactly is the sequence of events. I really appreciate everyone's patience over the past couple of years. Probably entailed more patience than anyone would like, but we're certainly committed both on the leadership level and on the staff level to making sure that we iron out the kinks and do that in a way where we produce even more.
Thank you. I think everyone knows we're kind of, what do you say, creating the plane while we're flying it? Not quite right. But
Changing the engine.
Changing the engine. No, I think that's so we're basically, I think there is such commitment here to get both programs up off the ground, but it is something new. So for 20 plus years, we've had these joint agreements, the New York agreements, which really laid everything out. But I think we're in a new world where we can do two parallel agreements, we can have those conversations, and it's kept us busy and it's kept everyone at this table busy. And so you heard from the capital side, and I'm going to switch over to Steve to talk about 1515 from the service side.
Great. Can you hear me in the back?
There we go.
Okay. I was a little bit sleepy when I first started, I guess. But everybody else woke me up. The numbers, I think, are pretty impressive given the time frame, and I think it's also important to remember on the city side, on the 1515, we spent sort of after the announcement a year working with the task force of providers and experts and advocates, and chaired by Maria and I, and before that Vicki and I. And we really were very much focused on having a program that reflected all the learning of the New York agreements. And so year one was really one of what could we develop in terms of recommendations. It's worth reading if you have the time. I know I don't have time to go through them all, but there's 28 great recommendations that are either fully implemented or well along in being implemented. And so essentially in a year and a half, we've made awards for more than 2,000 units. That's 1,400 plus units. On the congregate side, it's the service awards that go with the development properties that Maria talked about, and then there's also more than 600 scouted site awards that have been made. Our RFPs are open-ended, which means come on in. We're open for business. Please apply. We have regular meetings directly with me weekly with the team in terms of how we're moving forward. Obviously, finding scattered site apartments in a very tight rental market is challenging, but there are clients who benefit from this model in terms of greater independence and the service delivery in that setting, and it was, as a result of the task force, an important model to focus on. We have providers that have been and continue to be very successful with this model. And at the same time, we're providing additional support for the scattered sites, including studios at the 2018 FMR and various of the bonuses and apartment finding services that we have available to help move people out of shelter. So we're feeling very positive about the direction that things are moving in the challenging environment that we're in. I think that's reflective of the great partnership between HPD and the Department of Social Services, which includes HRA and DHS, but also the partnership with not-for-profit providers who are creative, who are innovative, and who are finding apartments under our programs. And so we're very excited about the fact that people are moving into them, and that ultimately that's what everybody in this room is focused on, as are we.
And Anne, if you want to talk about the state side, heading up the ESHI task force.
Yes, I think that it's been a really tremendous collaborative effort with many agencies, and everyone, I think, has worked really, really closely together to make this happen. I think it's an unbelievable commitment to housing that the governor has made, and I think it's moving. It's moving, and the housing is going to be there. So I know that it seems perhaps as maybe things could have been a little bit faster, but I think it's moving. Now, from the parochial view of mental health, about 30% of the assigned ESHI housing fits into this, working with the seriously mentally ill. Again, from the parochial view of mental health, we would like to see that, quite frankly, a little bit higher because the state's responsibility still and always will be in a special way for the seriously mentally ill. And the other thing is there's been a very low uptick on forensics, and that's I'd mentioned earlier, and I think that's something we're going to be thinking about. Only about 2% of the ESHI housing has been earmarked for individuals in the criminal justice system, and we know what a big problem that is from all angles, prison reentry, jail reentry, et cetera. So I think that's something that we're going to be looking at, but I do think that it's moving considerably, and I think we should all feel very proud of the effort that's happening. And just to add on the service side, well, I'll talk about homeless, but for ESHI, I think it's moving, and we're just hoping that, again, there can be a little more interest on working with some of the most difficult to serve seriously mentally ill, because I think that when they're in housing, guys, it's really terrific.
So as you know, ESHI has been less prescriptive in the populations and the targets for those populations. There's a lot of populations to consider in working with your local communities about what the need is. So I think that we're seeing how things are shaking out and where the interest is. And of course, I think to Dr. Sullivan's point, we still want to serve those most in need, which can tend to be our mental health populations. So a little bit of a plug for taking a look at that. And now I'm going to just turn to Barbara, kind of just the overall, on our overall homelessness plan for the state. The governor kicked off the Interagency Council on Homelessness. And I think it's being extended for maybe 6 months, so it's not quite at its end, but I know it's spent a lot of time going around and talking to stakeholders throughout the state. So can you just update us on that?
Sure. As RuthAnne mentioned previously, the Interagency Council on Homelessness for the state was established in June of 2016. There was an awful lot of activity in June of 2016, it seems, around homelessness. And it was initially planned to, to work for over a 2-year period. We have no plans at this time to end its work. We still have work to be done. Again, co-chaired by RuthAnne and also under the leadership of Fran Barrett from the governor's office. And I also must acknowledge the work of Linda Glassman from our office, as OTDA provides staff support for the Interagency Council. I know Linda and her staff have worked very hard to support its efforts. And again, the Interagency Council is really looking, as RuthAnne said, at kind of the nuts and bolts of the delivery of homeless services and where can we make improvements, what makes sense, what doesn't make sense. Where do we actually have the ability to make some changes to help those who are delivering services do so in a way that's more efficient and more effective. In addition to leadership from state agency executives, it also very much and very importantly includes leadership from 9 nonprofit leaders in the area of homeless services throughout the state. Again, in New York City and also in other areas of New York. That includes Dr. Rosa Gill, Tony Hannigan, John Paul Perez, Maria Skates, Melissa Spicer, Christine Quinn, Dale Zukleski, among those providing leadership for this. And from them, they decided early on to break it down and to really focus on subpopulations, because as you know, homelessness isn't kind of a one-size-fits-all. There are many different reasons people are homeless. And those subgroups, in terms of their work, they've been able to come up with very specific recommendations about how we can deliver services. Some of the accomplishments that have been we've been able to move forward with already include pushing forward legislation to better improve our service delivery to homeless and runaway youth, to expand the age of individuals who can be served up to 21, and also to provide a longer length of services to that population. Additionally, I think we've already mentioned briefly just some of the work with OMH and OASIS in terms of delivering services better to individuals who find themselves homeless. Also among the list of accomplishments include expansion of medical respite programs in New York State, and that's an area we know that we need to continue to expand that model. Again, it fills a very specific but a very critical need for that population. And then also we're about to move forward to launch a coverage of a balance of state continuum of care. So we have 5 areas of the state, 5 counties that are not covered by a continuum, and so OTDA plans to kind of oversee those areas and provide assistance for them so that they're able to bring in those critical resources from HUD that so far they've been unable to access, and so we will be moving forward with that. Again, it's been useful, again, in particular having input from the nonprofit community, and we're going to continue to on that work. RuthAnne, was there anything else you wanted to add? Nope? Okay.
And so I think we all struggle with, we have a lot of existing mental health housing that is not been funded adequately over the last number of years. There's a Bring It Home campaign to work on that. And it's our existing supportive housing programs. But we also have our issues of rent stabilization and our laws expiring, and really the loss of a lot of affordable housing units that has happened over decades. And so I wanted just both Maria and RuthAnne to kind of talk about where we are on rent stabilization.
Sure, I can start this one. So, we in New York City, I think we're fortunate to have one of the largest affordable housing and public housing stocks in the entire country, as well as a large and hugely important stock of rent-regulated housing. And so, of course, 2/3 of our households are renters. Half of those, about 1 million households, are rent-regulated, and that is a very critical stock and serves some of our more vulnerable neighbors in the city. However, we've continued to see the erosion of that, and of course, a lot of concerning signs. There is some good news, however. In our recent housing and vacancy survey, we just put out the numbers a few months ago. We saw a couple of things that I think are quite positive. One is that the rent-stabilized tenants benefited from low rent growth, and so that their rents grew by 2.6% compared to 9.3% for private unregulated units. And also in recent years, we're actually starting to see that we're stemming the loss of rent-stabilized apartments. That said, as I mentioned earlier, a lot of the protections seem to be eroding, and it's certainly a lot of what I hear on the ground in the work that we do at HPD. And so what we have done, or the types of things that are critical to this, include, of course, continuing to make good on the goals of the housing plan, continuing to be aggressive in terms of the preservation of units. A lot of the great policy work with mandatory inclusionary, certainly working with the state for the new 421A, all of those are the types of things that will pay dividends into the future. And of course, the new programs, the neighborhood pillars I mentioned earlier, that bring more of this stock into city regulatory agreements. So all of those are important approaches. We will continue, but of course, the work ahead given the expiration in Albany, is critically important. And the mayor has made clear what some of our priorities are going to be, working with different stakeholders. They include, but are not limited to, ending high rent vacancy decontrol, ending the vacancy allowance, limiting IAI and MCI increases. Really, these are the types of things that we think will provide the guardrails that are necessary as development happens, as growth happens in our city, which we want, which we need, given growing population, given the fact that the economy needs it, but the protections to rent stabilization and to that housing stock in many ways are protections to the core of what keeps our neighborhoods affordable. And so it is a set of discussions, a fight that we will take on with as much energy and vigilance as is needed, because there's just too much at stake.
So we implement, obviously, the rent stabilization law. There's about 900,000 units under rent stabilization in the city. It's complicated, right? It's a very, very heavily legislated system, and so we don't always have the discretion to do things that we would want, that advocates would ask of us. A lot of it is subject to the legislation. You know, I think a lot of people probably know this, but right, there wasn't even vacancy decontrol until 20 years ago or so, introduced in a longstanding system. So it has been sort of eroded, you know, over the years as different elements were introduced. Since the governor's come in, we, you know, are sort of proud of the fact that when the rent laws were renewed in 2011, the vacancy decontrol threshold was raised for the first time in a while, from $2,000 to $2,500. In 2015, it was raised again from $2,500 to $2,700 and also indexed. The system itself runs a bit like a court, and it really sort of adjudicates landlords reporting rents and tenants then filing when they don't believe those rents to be sort of accurate. So in response to sort of issues in the system, in 2012, the governor created the Tenant Protection Unit, which has really been an incredible tool to root out the bad actors in the system who are not following the law. So since 2012, we have returned about 67,000 units back into rent stabilization. We're very proud of that. There's always more work to be done. The TPU is a very sort of lean, stealth machine that takes referrals from anybody and everybody to look at, and they also look at anomalies, and they use data to try to find and root out, as I said, sort of bad actors in the system. We can only sort of see so much through data, so we really do rely on information from advocacy groups and others to tell us sort of what's really going on. And it's obviously an important relationship for us. Going into 2019, when we'll have the sort of next renewal, I'm sure people have already read that the governor has said that he's in favor of eliminating vacancy decontrol. There's many other parts of the rent stabilization system that I think people are focused on, and how those impact the people's rents and their stability in their apartments. And so we are working with a variety of different advocates to make sure we understand what all those levers are, so that as we go into 2019, we can be thoughtful about a package of changes. Obviously, as everybody knows, it's subject to the legislature, which is not something that we have control over. So it's a process. We are hopeful that as we get into 2019, important and meaningful changes will get made, or the system need to get made, and we would definitely encourage everybody to keep talking to us about things that they see on the ground, and about changes that are important to different constituencies, so we get to the right outcome.
Thank you. More to come, right? And Steve, can you kind of walk us through where we are on homelessness in the city? It's always in the press. We're at 58,000, we're not at 60,000. That's a good thing.
Okay.
Numbers going in the right direction.
Okay.
So give us an update.
Again, as I said at the outset, you can hear me in the back, right? As I said at the outset, the overall census has been flat for the first time in 10 years. But of course, there are seasonal changes. The summer, the families seek shelter when school is out and children are home, and it's difficult to maintain double-up arrangements. Winter, single adults seek shelter, so there'll be seasonal variations. But overall, we know we have much more work to do to address a problem which built up over the course of 4 decades, but we can see progress being made. And really, the plan that we put out a year ago has 4 pillars, and I can give you an update in each area if that's helpful. So first and foremost in our plan is preventing homelessness whenever possible. And there, the data shows that evictions by city marshals are down 27%. And that is really occurring at a time in which we have dramatically increased the amount of funding for legal services, lawyers and legal workers to prevent evictions in housing court. It was originally $6 million investment in 2013 before the administration started. In the coming fiscal year, it's a $93 million investment. And when the Universal Access to Counsel program, the first in the country, is fully implemented, it'll be a $155 million investment to ensure that tenants in housing court have representation. The increase in preventing evictions, that 27% drop in city marshals evictions, is also occurring against an increase in payment of rent arrears in order to prevent evictions. So preventing homelessness whenever possible is a key, and the data is showing that evictions by city marshals are down as a result of these investments. The second key pillar of our program is bringing people in from the streets. And as a result of the Homestead program, as we announced last week, the data shows that 1,815 individuals have been brought in from the streets and have remained off since April 2016. And that's a key metric. We often take victories where they come, and to bring someone off the street even for one night is a victory. But the metrics that we focus on is brought off, remain off. And so in a 2-year period of time, 1,815 human beings have been brought in off the street and either are now in permanent housing or in transitional programs. And that is happening against a doubling of the outreach workers, the not-for-profit outreach staff that are out 24/7, 365 days a year, a doubling of the number of safe haven beds, and shortly to be tripling the number of safe haven beds, and of course the first units of New York 1515 coming online. So all of that is a very important focus that we've got in terms of bringing people out of the streets. The third of the 4 pillars is rehousing people, and so we recreated and reinstituted rental assistance programs and also restored priority for NYCHA and Section 8 apartments. And since 2014, 87,000 men, women, and children have either been moved out of shelter or avoided going into shelter altogether. Most of those men, women, and children are shelter move-outs, and that is an important focus that we're going to continue to be working on in terms of rehousing people who become homeless. And the fourth key pillar is transforming the approach to shelter. And as I said before at the beginning of my remarks today, the shelter system built up over 4 decades in response to court orders and in a very haphazard way, and Band-Aid solutions were put in place. The Giuliani administration rented individual apartments in the cluster program, which at its height had 3,600 units that were being used. Going back to the 1960s, the city has used commercial hotels, renting individual rooms in commercial hotels off and on. And so as part of our transformation of the shelter system, we are focused on getting out of 360 locations that were either used as cluster sites or commercial hotels. And I can tell you that we are already out of 100 of those locations in the last year. So that's a 16% reduction in the shelter system footprint. We're focused on a 45% reduction. That's 360 locations that we will stop using. And as I said, we're already out of 100 of those 360 locations. About half of the cluster units have been vacated already, and we're going to continue on that trajectory. And we're replacing those 360 locations for clusters and commercial hotels with 90 borough-based shelters to give people an opportunity to be more closely connected to the anchors of their lives, just like all of us have anchors in our lives: schools, work, healthcare, houses of worship, family and friends. And so by taking a borough-based approach, we're going to provide an opportunity to be sheltered as close as possible to those anchors in life. We've already got 20 of these 90 shelters sited, 11 actually up and operating, and we're going to continue to focus on taking down those 360 locations, now down to 260, and continue to focus on the replacement of that system with a more people-focused, community-focused system as we move forward. And we look forward next year to giving you an update at this conference as well on the progress we're making. Again, we know there's much more work to do to address this problem that has been decades in the making, but at the same time we can see positive signs for the children and adults that we serve every night.
And Steve, any thought as to why the single adult population has an upward trend right now and families is declining? Briefly.
We could have a seminar on
Yes,
that,
yes.
I think. I think that you can see the impact of the investments in preventing family homelessness. Of course, 30% of the families in shelter have a history of domestic violence, and that continues to be a persistent problem. In terms of single adults, there was an excellent article in the New York Times this morning about parolees. We have almost 10% of our single adult system are people coming out of state prison. That is a very positive thing, but it certainly raises the urgency of finding housing solutions. There are certainly mental health challenges that are reflected in our population. But, I have to say, there was a question that somebody asked at the beginning that's supposed to be animating our answers, and I think that they have to some extent. There's a lot of good cooperation with OMH, for example, in focusing on deploying ACT teams into our shelters. We've got 10 teams that are out there, and got a caseload of about 400 already, and we're starting to see decreases in emergency department visits and services. So I think the numbers are reflective of some of the realities that my city and state colleagues have talked about in the housing market and the mental health systems and the criminal justice systems. And I think the best way to keep focusing is on the kinds of solutions that we put in place to prevent homelessness, bring people off the streets, and to rehouse people and address the way the shelter system operates. I think a lot of the conversation that was being had when we began the 90-day review was on, would people come into shelter? And I think certainly people are voting with their feet and coming into the single adult shelter system. I think that is as a result of a lot of hard work by many not-for-profit providers in this room and other rooms, the NYPD's role, the joint work with OTDA in terms of some of our model budget work and our new needs. It takes a lot of effort to focus on this, but it's something we're very much focused on addressing.
Dr. Sullivan, would you like to continue on that thread? And
Yeah, just there's, as Commissioner Banks was saying, there's a lot of need for the serious mental illness shelter system. And we have put up 10 ACT teams, and I think that they're pretty much getting full now. I think we've got all of them up and running, and I think about most of them are at full. A couple are getting close to being full. Their job is really to help the individuals with serious mental illness that are in the shelter system. Some of those individuals can spend 2 to 3 years in the shelter system before moving into housing, and we really feel that doesn't have to be that long if we wrap the right kinds of services around individuals, and also if we have the services on site to help those who are particularly having trouble, who are the frequent users of emergency rooms, who go a lot to the hospital, et cetera. So I think the ACT teams, we all know an ACT team is sort of community treatment. These are the kind of the hospital, the old, what they used to call hospitals without walls. Very powerful intervention. The other thing is that we have been working with the shelter system on, some of you are probably familiar with our Psyches database, and while clinical information will not be available, information about who's your care manager, who you're connected to, that will be available. The other thing that we recently got permission to do is to use HCBS services for the shelter population. This is also kind of exciting because it means that if you're housed there, we can get some of those services out to you. So there's a lot of positive work that we're trying to do with the shelter system to help our seriously mentally ill. And then lastly, the emergency rooms. You know, one of the banes of the existence, I think, of the shelter system and the CPEPs have been this kind of unfortunate lack of communication. And a little bit of clients would come in and then they go back and come in, everybody feeling frustrated. So we've started some very intense dialogues with the CPEPs that serve specific shelters. And I think that's bearing fruit at this point, both sides understanding each other better, and also sometimes from the state perspective, because we license those CPEPs, getting our CPEPs to pay more attention to keeping people a little bit longer. That's what we have extended observation beds for, and to really be partners in caring for the individuals in the shelters. And that's a big lift. They're very busy. Most emergency rooms are very busy. But I think we're working very closely with them, and I think we're beginning to see an improvement in the communication back and forth. So there's many pieces to working with the shelter system, but we all know that a lot of our clients are there and that they need some special assistance.
Thank you. And Barbara, I know you could also probably wax on about the homelessness system and the changes to it and the trends. But I did also want to give you a moment to talk about HHAP, because we're finding it even more crucial as a gap filler as we're financing city and state supportive housing deals. So can you update us on that?
Sure. Always good to have a little commercial plug for HHAP. You know, last year, I believe, was probably our shortest open season for HHAP due to the tremendous demand. We opened our RFP last year in early June and needed to close it by October because we had received a number of quality applications that we were able to fund. So that's good news. We did get quality applications in. We're able to move forward, get those projects funded. But there clearly is a need. Since that time, we've gotten in over about 140 million in other concept papers that have come in. So we do expect this year for the demand to be as equally as great. But we're prepared to move forward, to fund projects, get things opened. HHAP has definitely filled a need statewide. Over its history, probably about 50% of the HHAP units have been in rest of state, and the balance in New York City. Last year, that's beginning to shift in terms of more of our funding was going toward projects in New York City, which of course is appropriate given the need. I would also just add that with this year's HHAP RFP, for those of you who have applied in the past, we did make some changes, some kind of in the weeds, nuts and bolts changes to the application process based on information we heard from you and certainly through advocacy from the network in terms of how we could improve the way our application is structured, how we can align some of our policies and practices better among the state agencies. And so we have moved forward with those changes. We hope that you find that makes it easier. We also streamlined the application process for the portion of HHAP that is set aside for rest of state shelter repairs, also with the intention of making that less administratively burdensome so we can get the money out, make it easier for people to make repairs and to build housing. So, with that, we would encourage you to continue to give us feedback, give feedback through the network in terms of what's working, what's not working. We do listen because we understand what you're doing is very difficult. And it's our job, while making sure we're getting quality products, but also we want to make sure that we're doing so in a way that's not unnecessarily administratively burdensome for you.
Thank you, and we brought a lot of, not a lot, but some concerns around the MWBE program and how it's being implemented, a very important program, of course, and OTDA was terrific in really responding and working with us on those requirements. And I just want to turn to RuthAnne and Maria to kind of address Ralph's question, talking about the intersection of the city and the state around the supportive housing capital commitments and where we are potentially jointly funding supportive housing together, how developers might approach that. And I think we're all looking for as much clarity as possible, and I think you both spoke to that, because then it just speeds up the development process. So please, thank you.
I would say, obviously, many people are doing mixed city, state transactions, as has happened across the various New York agreements, and even now, sort of without an agreement, we sort of, as the state sort of umbrella, always look to work with our sort of local municipal partners and to be coordinated. We know there's been some challenges with our term sheets, and we, with the new ESHI and sort of 15-15 operating program, so we're going to release new term sheets this week that will modify our capital subsidies for deals in New York City to help and sort of be better coordinated with HPD. But at the highest level, just from sort of an overall kind of accounting perspective, right, ESHI and 15-15 will never sort of be on the same unit. So while we might capitally fund together, the overall commitment between the city and the state to the 35,000 units will remain intact, despite our sort of joint, or not despite, but in addition to our sort of joint capital. I won't speak for Maria, but I would say for us, we are happy to have projects that have 15-15 and ESHI. We are happy to have full ESHI projects. We are looking at 15-15s where that makes sense. So we are sort of open to whatever mix is sort of what the providers want, right? Many of you might have an ESHI award or have a 15-15 and want to combine them on a site, so there's no reason you can't do that or not do it. We want to be flexible and we want to work with everyone. We know there's enough challenges between siting and everything else that shouldn't certainly be an obstacle to getting the deals done.
I'll echo everything that RuthAnne said. I think despite the what I'm sure has been not the easiest road in terms of the interplay of the programs more recently, we haven't let a project get away from us that has had city and state sources. We want to make sure that they happen. We found a way with the projects that we have come before us thus far. It's continuing on what's been decades of collaboration between the city and state, and that can, we know that only has to continue despite not having a formal agreement. And so, which isn't to say that there isn't more that really does need to put pen to paper and clarify exactly how each and every element is going to work. That's something we're committed to. We will continue that. We want to get as much feedback, of course, not just through this conference, from the network and providers in general, so that we get it right. I have no reason to believe that we won't. It just will take a little bit of time, but it's something that both agencies are quite committed to.
And of course, the siting of supportive housing and of course of shelters has been ever more difficult in the community. I think particularly as there are very few in-rem sites left that we're dealing with, less as of right sites. And so any thoughts on how we can move forward with successful siting?
So I'll start. I think what's interesting is that a lot of ink has been spilled on the opposition to supportive housing or to development in general. And certainly there are many of those cases, and we've all lived through how challenging it might be in particular communities or particular stakeholders to advance projects. But the reality generally, just to give a sense, of the units of the projects that we've closed thus far, 2/3 of them require, for instance, some sort of city council approval, and we've been able to find a way to get it done, despite a lot of the well-publicized local opposition. It does not mean that we can take this issue for granted. In fact, in many ways, it's kind of the opposite, that we have to be as vigilant as possible, both about awareness and education of development projects in general, and of course with supportive housing. I think there are three things that might be helpful in this effort moving forward. One, for us at HPD, a big part of it is being as transparent as possible about what we are trying to do. We made changes, for instance, to our term sheets to require higher set-asides for homeless units for homeless households, and in our term sheets for the supportive housing loan program, also try to maximize clarity about what we are trying to do, so that it is apparent to everyone that we are doing this work. We try to do this work in as many neighborhoods as we can, because the need is so dire. The next two things, I think, are a joint effort. That has been the tradition, of course, in supportive housing, and I think we have to do even more. And so one piece of that is to make sure we are working collectively to dispel the myths about supportive housing. And despite the tremendous work that the network has done, that we try to do, that individual organizations try to do to educate, there's enough churn in local elected officials, enough changes in stakeholders, that work has to be ongoing, and that we do everything that we can to not just talk about supportive housing units, but to really humanize what it means to do this work. And everyone here is so expert at that, and that just needs to continue and to be brought up a notch as well. The last piece here is to make sure that we're not just humanizing, but also talking about the extraordinary benefits. We're always in the business of finding new solutions to long-standing problems, but it's also important to lean into proven models, and supportive housing is one of them, and to show how these projects can be and have been well-designed, well-maintained, real assets to a community. I don't think you can ever overstate that, and it's an effort that I think needs to continue. One of the things we've highlighted more and more is the fact that the design of the buildings is often of extraordinary quality. The Public Design Commission, for instance, did an entire report on affordable housing and design, and of the 7 or so case studies, 4 of them were supportive housing projects. I'm sure that's no surprise to people in this room, but it's precisely the type of message that we need to get out there with sufficient frequency, so that everyone can hear it, and that as the projects are cited, that they are truly seen because they are as community assets.
Thank you.
I might do a little plug for Vital Brooklyn. So as many of you know, the governor announced this big initiative into central Brooklyn around health and wellness. And as part of that, we released 5 sites in affordable housing RFPs, which was very exciting. It is not something that HCR had done before. And many of the sites were all sort of programmed in partnership with the state electeds covering those areas, and many of them through their community efforts have identified supportive housing needs that they would like to see. There's one very big site out in Brooklyn at the Brooklyn Developmental Center, an old OPWDD site, as well as 4 other hospital sites that are underutilized parking lots on hospital campuses. We did the first release of those 5 sites. They're due back in July. We have another 5 or so sites that are going to go out later in the summer. So we are sort of trying for our part, certainly in the footprint of the city, to provide some sites that would be welcome to have supportive, and sort of they obviously all have sort of a health and wellness kind of focus to them, as well as supportive housing into those. So I'll just take that opportunity to do a little public service announcement for Vital Brooklyn.
No, that's great. And I think also Dr. Katz, head of health and hospitals, is also looking at his inventory. So that's been a great resource for supportive housing. And just a plug for us as well, it is very helpful if you come to us sooner rather than later before you go to your community board. Cynthia Stewart in our office is kind of the neighborhood guru, and we know all of the projects that have been. We will prevent you from going on the same night as another nonprofit and talking about supportive housing, which is very important. So definitely check in with us. And so with that, I think I'm going to just open it up to the audience for a few questions. We have a mic right here in the center of the aisle. If anyone would like to come up and ask a question, or if you feel like you're loud, we have a mic that can be brought to you.
Hi, I'm Bonnie Mohan from the Bronx Health and Housing Consortium. So we know that healthcare impacts people's housing and housing impacts people's health. I was really glad, Barbara, to hear you talk about medical respite. It's a gap that we have in New York City and state for people that are kind of in between the health and housing systems. I would love to hear more about your plans to expand medical respite. This light's really bright. And also for you, Steve, to hear what your thoughts are on the role of the shelter system to address people's medical needs, physical health needs that are in your shelter system, as well as those who are locked out of the shelter system because of their physical health needs. And is medical respite something you've thought about, particularly kind of co-located with, within a DHS shelter?
Just in terms of at the state level, obviously identifying the very few positive medical respite programs that we do have in the state of New York and learning more about their outcomes and the different models that are there to see to what extent we can support and replicate those. Because again, obviously it fills a very real need of people who are not ill enough to remain in a hospital or a nursing home possibly, but certainly are also not appropriate for shelter, and it would place an undue burden on the shelter system. So it's just something that we're continuing to explore. Again, there's been some expansion. We're hopeful to be able to expand more with that model because again, it's an obvious need that's filled. There is a work group, I think, looking at some challenges associated with moving in that direction and trying to come up with some ways to encourage the replication throughout the state. So we are hopeful that by paying attention to this and identifying the need that we will be able to expand further.
Yeah, I would just add to that I think two perspectives. I think the state regulations that speak to making sure that the shelter system has only housing people within it that have the ability to be served by it is an important standard. And my perspective in litigating against the two agencies that I now run, someone informs my perspective in actually running them, which is that the homeless system over 4 decades has essentially become the default for every other system that isn't working. And now that I'm in government, I have been very consistent on trying to focus everybody on that fact. That there are tremendous needs that people have who are low income, and we serve them through HRA in terms of cash assistance and income supports, but that we need to take a broader look at the systems that feed the shelter system and be very careful in making sure that we don't continue to the trend of the last 40 years, which is when we identify really critical needs like respite care, that we don't continue to expand it as a shelter system issue. That's not to say that there shouldn't be a solution and that I'm not happy to be part of a conversation with the state and anyone else about solutions, but I just want to caution us on viewing shelters as a default for everything else, because then everything else focuses on, oh, we can move it further downstream. And you see it in what I said about parolees. You see it in what we said about what Ann said about the state hospital system. There's a reason why we've got 60,000 homeless people in the shelter system, or 58, depending on what night you look at it. And I just want us to all be very focused on the feeder systems and what changes we can make in those systems to avoid the kind of situation we've got. But happy to be part of any conversation and be assisting and looking for solutions.
Thank you. Other questions?
My question is, I guess, primarily for Mr. Banks. Looking at the vulnerability assessment that ranks approved applicants for supportive housing. Sorry, can you hear me?
Just looking for where you
can
are.
stand up. Oh, stand up, yeah.
I couldn't see you.
Yeah.
Now I can see you.
Hi. So my question is specifically about the SVA, the vulnerability assessment that HRA uses to rank approved supportive housing applicants for placement. And the way it is right now, it's really measuring multiple systems usage, which can be the same thing, well, can have overlap with vulnerability, but isn't really quite the same thing. And I'm sure you know from your experience at Legal Aid that oftentimes some of the most vulnerable homeless New Yorkers can look like someone who's street homeless and purposely avoiding systems trying to live off the grid. And that's something that we see a lot at our agency. Those folks are always ranked as low priority for placement, low vulnerability, because they don't have the multiple systems usage. And I was wondering if there was any plan to try to maybe address that or look at the vulnerability assessment?
So I think it's a good question, and thank you for all the work that you do at your agency. The vulnerability index was developed through the task force, and I think the task force was very focused on how do we make sure that the people who have the greatest need get connected to the units, bearing in mind that there are differences between those who can do well in scattered site and those who cannot. Having said that, it's relatively recently rolled out, and we continue to look at how it is playing itself out, and certainly happy to have your input on that point as we look and how we can enhance it. But again, it came from a perspective of a task force that was very much focused on how to make sure we can connect this scarce resource to those who have the greatest need, and how can we create some objective way to do that. Again, having said that, we continue to look at ways to make improvements, and we'll certainly take your question into account. And there are others who have raised similar issues about continuing to look as we implement how to improve what we're doing.
And so I also get to co-chair the continuum of care for the city, and so there's a CAPS panel later today. A lot of work is going in. It's a very iterative process, but I think for special populations that do not use multi-systems, potentially youth, street outreach, we are looking at those populations individually to really see what's the best formula for figuring out vulnerability. So there's a lot of work, we're getting a lot of input, and we really appreciate everyone letting us know what's working and what's not. Tom, I think you had a question?
Well, thank you, Laura, for putting together such a great panel. I'm Tom Hamline, president of Help USA, New York City-based not-for-profit, and I have the great privilege of currently working with all 5 of your guests here, your speakers. I do notice you have 3 on one side and 2 on the other, which leaves room for a 6th. And I want to suggest that if we're going to really address homelessness and drive that number south, which we're doing a lot of work with the commissioner on that, we need to really look at the flow of funds and the finalization of contracts and how money is coming to the not-for-profits so that we can keep the wheels greased to keep things moving. I think that we are at a point in time where we have tremendous ideas, tremendous creativity, we see tremendous working together at the programmatic level between the different state and city agencies, et cetera. But we are currently limited financially, and it is a problem that is not directly controlled by anyone here, but I think that my colleagues in the audience might agree with me that if you could help us address that and improve that side of the equation, we would all be very happy. Thank you.
I'm going to be brave and answer first. As a former head of a not-for-profit, I certainly understand the complexities of operating a not-for-profit. I also understand the complexities of contracting with government. I think it is one of the reasons why we've gotten authority to invest, again, about $250 million into the sector. And we're going to keep working with you and trying to get those dollars out. But I hear what you're saying as a general matter. And I guess if I was at Passover, would leave a chair empty. Is that your? So we'll see how we do next year.
Big table. Okay, please join me in thanking our panelists.